A new change with the new year. You can now find hospital pricing lists online.
It is all part of a new federal rule that went into effect today, and the idea here is to help consumers compare prices before seeking treatment.
Now, 41 Action News anchor Cynthia Newsome, though, explains why it may not be that easy.
Yeah, that's right, Krista and Mike. The first hurdle consumers face is finding the price list. They're on each hospital's website. Now, this is the price list at the University of Kansas Health System. There are some of the costs there, as you can see. But to find it, I had to go to the website and finally looked under Patient and Visitor Guide. Then the real work begins to try and compare prices between different hospitals. So I printed some of the price lists and took them down the street to customers at Pizza 51 to find out what they think and if they plan to use it.
Kit responsive, neuro something, $127,000.
What?
One look at the list.
I would just say keep it.
And it didn't take long for brothers Elias and Everett to react.
I just think it's crazy numbers, like the fact that it's $1,000 for a tattoo removal.
They're looking at the cost of care at 3 different hospitals, but all 3 documents have different formats. The University of Kansas Hospital has a 200-plus page itemized list of procedures, equipment, and medicine. Truman Medical Center also has an itemized list, so consumers would have to know everything they would need for a procedure or service. The price list at Overland Park Regional Center is much shorter. It describes common procedures and gives consumers the estimated maximum and minimum cost. The new federal rule forcing hospitals to reveal their prices is designed to help consumers compare hospital prices and make empowered choices.
If I were to go to a hospital and once I see my bill, I would definitely probably go back to it and be like, hey, this is what you have here on your site. This is what's available to view. Why is my bill so X amount of dollars?
It is very helpful, yeah. You can obviously then you can do your research and like find out what you can afford and what you can't afford.
1 milligram of something, $1,811.
But with all the different price list formats and complicated medical terms, these consumers are hoping they won't need to comparison shop.
I think I'm trying to stay healthy and not need to go to the hospital.
All right, that's a plan. Both brothers told me insurance, not cost, is the most important factor when they're choosing between hospitals. I asked the same question on my Twitter poll today, as you can take a look, and with more than 300 responses, an overwhelming number of voters said that they want insurance over cost or even their preference of doctor to decide where they go, which hospital they go to. Cynthia Newsome, 41 Action News.